Hello everyone, my name is Nicole Arm, and today I wanted to talk to you about vaccine hesitancy. The World Health Organization refers to vaccine hesitancy as a delay in acceptance or refusal of vaccines despite availability of vaccination services. And today I wanted to focus specifically on the MMR vaccine due to the recent influx and reported measles cases in the United States. Why is it important to address the problem? When it comes to preventing diseases, vaccines are a valuable strategy. Vaccinating is a primary prevention strategy aimed at large portions of the population to stop the onset of disease. Vaccines are a relatively successful prevention strategy, especially when it comes to the measles. Measles is a highly contagious respiratory disease that has no causative treatment. Measles is also easily spread after contact. Someone who didn't get the vaccine is 90% likely to develop the measles. According to the CDC, as of May of 2019, there's already been 981 confirmed cases of the measles in the United States. This, as you can see, are the most cases in the past 10 years. This is over tenfold the number of cases we've seen in 2016. Now, when people choose to get vaccinated, herd immunity comes into play. Herd immunity is when a large percentage of the population is vaccinated. The spread of the disease is limited. This indirectly protects unimmunized individuals, including those who can't be vaccinated, and for those whom vaccination was not actually successful. The image on the left displays how the disease can spread when there is no immunization among the population, and as you can see, the people are more susceptible. Now, the image on the right shows how immunization can stop the spread of the disease and, in return, provide protection for those who were not vaccinated. My target population throughout the term has been upper middle class parents in the United States. More specifically, this population is of non-Hispanic white descent, having private insurance. They are often married, over 30, and a college graduate. Their income is usually found to be 400% greater than the poverty level, which is how we classify this population. Risk factors associated with this population include safety concerns about the vaccine, misinformation or lack of information about vaccines, the perceived susceptibility and severity are often low in association of the measles, the cost of the vaccine, and no confidence that the vaccine works or that there is even a need for it. Keeping these risk factors in mind, we can now explore several theories that address not only these factors, but also intervention attempts at using said theories. First, let's look at the value expectancy theory. The value expectancy theory states that people will change their behavior if the benefits outweigh the cost. Specifically, let's look at the theory of planned behavior. The theory of planned behavior focuses on several concepts, including attitude towards the behavior, subjective norms, and perceived behavioral control, which all influence behavioral intention. In an article by Prislin, they explore how parents' beliefs, attitudes, and external factors mediate immunization status. They found that external barriers were the leading cause of vaccine hesitancy among the population. Now, these external factors included beliefs about the effectiveness of vaccines, safety concerns, distrust of medical professionals, and a belief in natural immunity. These are factors that should be addressed in order to have a successful intervention. Value expectancy theories can positively drive intervention strategies for vaccine hesitancy. The information motivational behavioral skills model recognizes that information and motivation can influence behavioral change directly, or it can influence behavioral skills that will ultimately influence behavioral change. In an intervention by Glanz in 2017, Information was provided to pregnant women through websites about vaccinations for their child. Glands found that the intervention group that received this information resulted in a high immunization rate than that of the control group, and the control group did not receive any information. The theory of reasoned action should also be discussed under the value expectancy theory. The theory of reasoned action is similar to the theory of planned behavior, which explores how attitude towards behavior and subjective norms influence the behavior in question. In 2005, Henriksen ran an intervention designed to better train physicians to communicate with pregnant mothers about vaccinating. They attempted to target attitudes of these mothers. In theory, this information coming from a trusted physician should have proved to be successful. However, it was not. Henriksen saw no decrease in vaccine hesitancy among the participants. However, it is worth mentioning that Henriksen does state that physicians didn't report feeling more confident after their training. The idea of better equipping physicians should not be abandoned as an intervention strategy. Now, I would like to explore fear appeals in relation to vaccine hesitancy. Fear appeals are persuasive messages designed to scare people by describing terrible things that would happen to them if they do not do what the message recommends. The health belief model falls into this category, as different concepts such as perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cues to action, and self-efficacy explore to determine what influences people's behavior. In an article by Nyan in 2014, they looked at how information about vaccine safety and the dangers of not vaccinating compare in the decision to vaccinate. To emphasize the dangers of not vaccinating, they used dramatic narratives and visuals to make those risks more visible. If you'll recall, low perceived risk and perceived susceptibility are two of the major risk factors associated with vaccine hesitancy. However, in this case, Nyan failed at increasing perceived threat through trying to increase perceived risk and susceptibility. At another attempt to target perceived risk and susceptibility, Cacciatore wanted to understand what effect awareness of recent outbreaks had on vaccination rates in 2016. The results indicated that participants that were more aware of the measles outbreak perceived a greater threat, and therefore they were likely to be vaccinated. This is important to keep in mind when designing an intervention strategy. Fear appeal interventions. First, let's look at an intervention that demonstrates the extended parallel process model. Luciano, Watt, and Sala led an intervention in which they provided participants with materials and warnings about unvaccinated children and diseases. However, this intervention led to an increase in misinformation about vaccines. In the extended parallel process model, if a message is successful at increasing perceived threat, the person can either increase protection motivation, which would lead to an adaptive change, or if the threat is too high and perceived efficacy is too low, the person can go into a state of defensive motivation, which leads to a maladaptive behavior, or the opposite effect we were hoping to have. This demonstrates that fear appeals should be carefully chosen and not be too overwhelming in order to be successful. In another intervention strategy involving fear appeals, let's take a look at the health belief model. In this health belief model, Betch decided to explore fear appeals in favor of vaccine hesitancy or in favor of not getting vaccinated. They emphasized the dangers of vaccines through vaccine critical websites. This resulted in participants being even less likely to vaccinate than before. Although this intervention isn't on message with decreasing vaccine hesitancy, it is important to understand that fear appeals can be delicate and powerful in an intervention environment. If used correctly without being overwhelming, fear appeals can have an effective use on intervention strategies. Stage models. Stage models acknowledge that individuals pass through several stages before adopting a health behavior. Specifically, the trans-theoretical model of change has 5 stages. These stages include pre-contemplation, contemplation, preparation, action, and maintenance. A study done in 2016 by Corbin and Leask targeted strategies for addressing risk factors, such as increasing access to information, having a sense of control over the decision-making process, and talking to others. They looked at these strategies while also keeping in mind the stage someone was in. The results of this study indicated that intervention in earlier stages, such as pre-contemplation and contemplation, would be more effective at addressing risk factors, which is something we should keep in mind when designing interventions. Stage model interventions. Now let's explore how the trans-theoretical model is applied to interventions. In a study in 2012, Leask took a very specific approach in order to increase vaccination rates and prepared different goals and strategies based on the stages parents were in. It was determined that targeting these specific stages and tailored goals showed promise, and Leask theorized that stage models in combination with communication strategies could prove to be a very successful intervention strategy. Best theories for addressing health behavior. As we have discussed thus far, value expectancy theories can be successful at addressing vaccine hesitancy. Keeping in mind highlighting risk versus reward, or the dangers versus the benefits of vaccination. When designing an intervention with the value expectancy theories, it is best to address attitudes, beliefs, and external factors of your target population. While fear appeals have proved to be finicky if used incorrectly, focusing on increasing perceived threat and emphasizing the dangers of not getting vaccinated could prove to be successful. We have also discussed stage models and how others have had success tailoring interventions to the stage someone appeared to be in. To best address vaccine hesitancy, parents should be targeted early while they are still in the pre-contemplation or contemplation stages. Intervention strategies. I believe an informational intervention strategy should be implemented to design a successful intervention. Providing information on the safety of the vaccine, cost of vaccine, vaccine efficacy, and the dangers of not vaccinating will address several risk factors. This information will also touch on value expectancy theories with the intention of shifting beliefs and attitudes towards a more positive view on vaccinating. Providing information of the dangers of not vaccinating will aim to increase perceived threat associated with fear appeals and further describe a need for vaccines, addressing yet another risk factor. Pushing the idea of perceived risk of not getting vaccinated should be emphasized and achieved by increasing perceived susceptibility and perceived severity. When it's time to vaccinate, don't approximate, be informed. This saying should be the first step to encourage parents to want more information about vaccinations. This information should not only be available, but sent out to parents at different time points throughout pregnancy, such as 1 month, 3 months, 6 months, or 9 months, and even after birth. Providing parents with information while still pregnant gives a better chance of trying to target parents still in the pre-contemplation or contemplation stages before they've decided not to act. Several resources should be made available to get information out there to parents, such as pamphlets, websites, access to physicians who can answer questions for these parents, and maybe even a text hotline where specific questions can be answered. Information provided for this intervention. In these resources, the information mentioned previously, such as vaccine safety information, should be provided, the cost of vaccines, which is often free with insurance, or information about free clinics in which you can receive the vaccine, vaccine efficacy or the success of the vaccine at preventing measles, and the dangers of not vaccinating. The dangers of not vaccinating could include current statistics of measles outbreaks in their area or in the United States to increase susceptibility, and the effects that the measles could have on an infant to increase perceived severity. Providing a ton of information to parents in the pre-contemplation and contemplation stages will help to address risk factors and push parents to make an informed decision. By incorporating risk versus benefits of vaccines in this information and increasing perceived risk in this informational campaign, I think when it's time to vaccinate, don't approximate, be informed would prove to be a very successful campaign. Thank you for listening. These are my references I've used throughout this presentation. Thank you.